Okay. We had the case of Harry Houdini. My name is Kaili Batchelor.
My name is Courtney Bitson.
Noah Gordon.
All right, so analyzing the case. Harry Houdini is an 82-year-old white male who was referred to a hospice agency. Harry lives with his wife of 60 years and has been her caregiver for the last 20. Due to her being wheelchair bound and presenting symptoms of dementia. Harry was admitted to the hospice services diagnosed with less than 40% kidney functioning and symptoms of dementia. Chronic back pain was also identified. In addition, Harry also shows symptoms of bipolar disorder like heavy mood swings, diminishing interest in daily activities, excessive guilt, and distractibility. He has a history of psychiatric admission for manic depression 50 years ago. When hospice went to meet with Harry at his home, they found a back taxis notice taped to their door and multiple hazardous conditions in their home, including steep stairs, doors that did not lock, no ramp accessibility, exposed electrical wiring, and a leaking roof. Although both Harry and his wife had been diagnosed with dementia, they do not have a legal guardian in place. The couple have 2 biological daughters and an adopted son. Both daughters have refused to be involved with the care of their children or of their parents, and their adopted son, acting as financial attorney, drained their accounts and has fled the state. Harry believes that he is competent enough to continue taking care of himself and his wife and is refusing services. So our research question is, what is the best intervention to treat dementia with symptoms of bipolar disorder in the case of Harry Houdini? And 2 possible interventions that we found. One we have chosen for Harry would be cognitive stimulation therapy, or CST, to help treat Harry's dementia and his mood swings. Cognitive stimulation therapy is a program-themed activity that is carried out over several weeks in a small group or in small groups. The therapy helps to improve mental function and improve memory and includes topics like childhood, food, using money, and current affairs. CST is also a therapy that can be done at home in one-on-one sessions and are meant to be fun and enjoyable. The second intervention we have chosen is a prescription of lithium to help treat his symptoms of bipolar disorder. Lithium is believed to help strengthen nerve cell connections in the area of the brain that regulates mood, thinking, and behavior. There are also some studies that are showing a potential for lithium to help in the treatment of dementia as well, believing that lithium may have other healing properties in the brain affecting memory, though it was noted that more research was required to be done on lithium's true effects of dementia symptoms.
Okay, so for my section, we basically just had searching the evidence. So based off the 2 interventions, here are some of the articles that we found that we feel will be most beneficial for the Harry case. So when it came to the cognitive stimulation therapy for dementia, we found some articles that we found that just were best suited for Harry. And then also for the lithium prescribed bipolar disorder as well. So throughout this whole entire process, it was basically just us finding articles, making sure that they were reliable sources and everything. So we had to use the databases that we mostly used were the Google Scholar and ProQuest. We also used the SVSU databases, which also like has ProQuest as well. So that was very helpful. There were multiple articles and research that related to the topic, but our decision making was based on a lot of different aspects. Mostly the articles had to provide some kind of study conducted on individuals similar to Harry. So for Harry cases, most of the articles that we found were like related to older adults. And another thing that we looked out for when making sure the articles were up to date and were published within the last 10 years. I know that, especially when doing the research, we ran into issues like, oh, you'll find a good article and then you'll end up looking and then it will be from like the 1990s. So that really wasn't, not really something that will be reliable as for now. And then for the databases used, like during the research process and using certain databases, we ran into issues of finding like actual credible sources, but not having full access to the entire article. So it'll give you like a brief snippet of what the article is, but you won't actually have all the information provided. Just some sites and databases, we didn't have access either. You had to like pay or subscribe to it. As for the keywords, when searching for evidence, we focus on the presenting problem, such as like dementia and bipolar disorder in adults. This basically just helped like narrow down our searches and which articles that we wanted. And we were also making sure that we were finding evidence-based practices and for the interventions. So like our articles pretty much had to be systematic reviews and empirical articles.
So CST is a group or individual therapy with themed sessions with multiple activities. So sometimes the themed sessions could be mostly about language, exercise, and then the activities that they do just kind of help them, be able to speak better or maybe make their bed better. So it focuses on engaging dementia individuals with an optimal learning environment, along with developing social psychological and physical benefits. Lithium is a mood stabilizer, treats mania and often used for bipolar disorders, helps reduce the frequency and severity of manic episodes. So the studies that we found were like systematic reviews, comparative researches, and cohort studies. The purpose of the articles were how CST and lithium stack up against other treatments involving dementia or bipolar disorder, the relation between lithium use and dementia risk in bipolar disorder. So some of the results that I found were that like CST found to have really helped patients with language skills, physical skills, memory, and a better overall quality of life. When compared to other treatments, CST had better positive results and had long-term positive effects. So like an example, researchers split participants into two groups. One was using CST and the other were using TAU, which is basically just a bunch of other treatments that they normally use. And this was in 9 different care facilities. They used many reliable measurements that measured their cognitive functions. And they also interviewed each patient and caregiver. They found that CST had a positive score with 8 out of 9 care facilities compared to the other treatments, which was like 6 out of 9. Lithium also reduces bipolar symptoms and has a possibility of reducing dementia risk and compared to other mood stabilizers. This possibility is supported by the fact that lithium-treated patients had lower baseline rates of cerebral vascular disease and diabetes than those treated with anticonvulsants, which was what they compared the treatment to. Both of which have been associated with increased rates. This was a population-based cohort study of 23,000 people, and they observed and measured the symptoms after 2 years. They also found that 72% of participants who used lithium past the age of 80 had improved symptoms, although they also saw some side effects which were more prevalent in that age range. So what did I learn about our question regarding the studies? I learned that like CST had more evidence to treat dementia disorder than lithium. Although lithium did show signs of reduced symptoms, it's just there wasn't enough like research on it. And also CST was more than one dimensional, can help Harry by improving his cognitive and physical functions. Lithium is commonly used mood stabilizer for bipolar disorder and has evidence, but it does have side effects, and it's something that I feel like we should look out for. CST has no side effects, and it's safe to do.
Okay, so which intervention is most appropriate for Harry's case? So, since dementia is the main concern and is diagnosed, and he wants to live on his own, we chose that CST as the best intervention. CST has shown to improve the quality of life and cognitive functions like language, memory, and physical skills. This will greatly impact Harry since he wants to live on his own. When looking at the comparative research, it showed that clients had better results using CST over various other treatments that were used. This shows the effectiveness of CST. The reason that we didn't choose lithium is because his bipolar disorder is not diagnosed. So the main concern would be dementia right now. Although lithium did show some evidence of reducing dementia risk in the elder, there still needs to be much more research done to test its validity. When looking through the articles, we saw that elders age 80 and up had a higher risk of side effects when taking lithium. So CST is something that Harry and his wife can do together to help with their dementia symptoms and could also help with some of his bipolar symptoms. Since Harry is experiencing mild cases of dementia, the CST session will hopefully slow down those rate of symptoms. As for his wife, CST could help to improve some of her functioning in the hopes that she and Harry are able to live more comfortably. It is evident that Harry does not want to be admitted into any kinds of living assistance homes. So it is important that he is meeting his practitioner in order to receive treatment so their mobility and functioning does not get worse. It is important that the practitioner respects Harry's wishes of not wanting any services, as Harry wants to be able to live at home and take care of his wife himself, but also needs to communicate with him about the best options for both himself and his wife.